Good afternoon. Peter Gertz here. I'm a psychiatrist, and there are a lot of different opinions amongst psychiatrists, mental health professionals, the lay public. Are psychiatric medicines good or bad? And I'll talk to you about my personal opinion. I've been a psychiatrist for quite a few years now. Worked on inpatient units, outpatient clinics, private practice. I've been on call, done consultation liaison. Anyways, so a variety of things. So are psychiatric medications good or bad? In my opinion, they're neither one. They're neutral because they can be very good, they can be very bad in the sense that they can have very positive effects for people and they can have very negative effects, side effects, which can be very troublesome. So they can have very good effects acutely, for instance, emergency rooms, agitated patients. That's, I think, a little easier for most psychiatrists to agree on, even though there are some psychiatrists who are essentially anti-psychiatric medication. However, to my knowledge, none of those psychiatrists work with acute emergency room patients or with agitated patients on hospital wards, like demented patients, delirious patients. So I think it may be difficult for psychiatrists who don't work with such patients to have a clear, even form a clear opinion on those patients if they haven't recently been working with patients like that. So acutely agitated patients, I think it's pretty clear. You don't want them destroying things. You don't want them hurting themselves. You don't want them hurting others. But you do have to be careful. For instance, the antipsychotics that are often given for acute agitation can cause side effects like EKG abnormalities, QTc prolongation, orthostatic hypotension, so lowering of blood pressure, especially in elderly patients. So one does definitely have to be careful. So this is going to be a very brief video. I'll be talking about this probably in further videos. So on the positive side, on the negative side regarding psychiatric medicines, they definitely can be helpful acutely, like I said, but on the negative side, they can be very difficult to get off of. Some can be outright addictive, like benzodiazepines, like the Valium family. So it can be very difficult to get off them. One needs to do that. In general, the way to get off psychiatric medicines is gradually and slowly. It's not always the case. There are a few psychiatric medicines that can be abruptly stopped, generally without a problem. So, like I mentioned, benzodiazepines can be a real problem to get off of. Them we want to taper off gradually and slowly. If you stop a benzodiazepine abruptly, you can cause serious side effects like a seizure. And it's also a good idea to try not to give benzodiazepines to a patient for a long period because they can cause adverse effects like memory problems, even potentially dementia in the long run. So overall, it's wise to be very careful in getting off psychiatric medicines and do that slowly. And on both sides of this issue, both with stopping medicines and starting medicines, psychiatric medicines, you want to, in my opinion, really respect the wishes of the patients, because let's say if a psychiatrist is only focused on psychiatric medicine and does not want to prescribe, does not want to do psychotherapy or use any other methods, that I think is probably a too narrow approach. And on the other side of the coin, a psychiatrist who does not want to prescribe psychiatric medicine at all may also be a too narrow approach, in the sense that, I mean, one major thing is, in my opinion, one needs to respect the patient's preferences and opinions and what they want. Some patients do not want psychotherapy. Some patients do not want psychiatric medicine. So we want to, if at all possible, respect the patient's opinions. And some patients do want psychiatric medicines. And some patients even are desperate and really want shock treatment, ECT. So bottom line, in my opinion, we want to respect psychiatric patients' preferences and their opinions. All right, more probably in another video soon.